I'm Mickey Kollisch. I am one of the pediatric surgeons here at Upstate Medical University. I did my medical school and residency training here, and I trained in subspecialty fellowship in Little Rock, Arkansas. And I'm so excited to come back. I've been in upstate New York for over a decade, and I consider it home. One of the great things about being a pediatric surgeon is that you get to take care of a whole breadth of clinical pathology. And that includes neonatal diseases, disorders of the chest, as well as the belly, trauma patients, and critical care. So the great thing is I'll be able to take care of all sorts of pediatric patients. The two areas that I'm particularly interested in are minimally invasive surgery, so thinking about different advanced laparoscopy techniques, as well as colorectal disorders. Like most pediatric surgeons, we're all really interested in neonatal pathology as well. From a research standpoint, my research interests are in lung pathology and critical care. And so being a part of research, it really allows me to take what we're studying and not only treat the patient, but also kind of develop future therapies for those patients. I will always treat the patient as a child and as a patient, and not necessarily focus in on the disease process. So I'll always think of them sort of from head to toe, but also thinking about the child with respect to the family members. And the fact that we get to treat and help both the child and the family members is really exciting to me. I've always known for drawing pictures, and so I usually have a little notepad that I go into rooms with to make sure that everyone's on the same page. And the other thing that I bring is, again, the fact that I have some research experience, so that I'm kind of always up to date on some of the new techniques that other physicians around the country are doing. One of the cases that I had that was interesting was a baby that was born in the NICU, and the baby was born particularly early, so small that the baby really just fit into the palm of a hand. And this baby needed an abdominal surgery, and unfortunately at that age, in general, we tend not to do that surgery in an infant that small. And so this was another time that we were really able to bring the parents into the discussion, into the decision making for the child. And we ended up doing the surgery, which sort of pushed the boundaries of medicine, and the baby ended up doing okay. And the idea of being able to continually push the boundaries that we've set in medicine and find new therapies and new techniques and start to feel more comfortable is really exciting.